Here in Gaza City, the main hospitals and hospitals all over this strip really struggling. I warn you, the pictures are graphic.
Overnight, Israel pounded the town of Rafah relentlessly. The only acute hospital was evacuated after a shell hit the entrance. According to the health ministry, more than 60 people have died in the past 24 hours. At the Shifa hospital in Gaza City, doctors are struggling not just with emergencies, but with a backlog of essential operations in buildings surrounded by refugees. This man, a student, has a leg wound. The bone is exposed. He's been waiting 8 days.
Me and my cousin were on the street, near a house that was blown up and shrapnel hit my leg.
The doctor treating him is a British Palestinian volunteer. An eminent plastic surgeon, the Israelis made him wait 2 weeks before they let him in.
No, he's a lucky boy. He doesn't have any fractures, he doesn't have any nerves that were hit.
It's tricky though. The ultrasound he needs to find the arteries is dodgy, the scalpel's blunt through overuse.
And the patients that are well enough to be cared for on an outpatient basis, you can't send them home because they have no home to go to. You really don't want to be sending someone with an open wound back to live in these makeshift tents that you see. So slowly the system is coming to a gridlock.
We asked him how much longer till it breaks.
Not much, I think a few days and that's it.
There are only 31 intensive care beds in Gaza, 14 of them here at this often chaotic place. Casualties arrive constantly. A father with his son hit by a tank shell in their home. It's quickly clear that they are beyond needing intensive care. On a break from operating and out of his scrubs, Dr. Abu Sitta describes a mounting crisis.
We've tried to evacuate some of the patients to other hospitals. Also, they've gone blocked up. We opened an incomplete building in Shifa, but that had to be evacuated yesterday because the Israelis threatened to bomb it.
Why did they threaten to bomb it?
We have no idea. It's an empty, incompletely built wing of the Shifa hospital, and we had to move all the patients out last night.
To Palestinians, the extended family is a lifeline, but even some extended families have been wiped out completely. 3-year-old Ahmed was hit by fragments of a shell that struck the UNRWA school at Beit Hanun. His uncle shows me the pictures of the shrapnel and the wound. His mum sleeps here, they've nowhere else to go, and there are thousands like them.
It's dangerous, there's nothing left. We've no home. My children are homeless, they are staying in different places.
We need medical teams to be brought in, we need patients to be taken out, and we need this carnage to end.
What's stopping that is the siege imposed by Israel to the north and Egypt to the south.
After weeks of war, the pictures can look like the same thing over and over again. Bombs, dead people, the injured. But for the health service, the effect is cumulative, and it's about to crack.
There is already an outbreak of scabies in the camps. When the water supply begins to look like this, other, more lethal epidemics may be close at hand.